my daughter, Zoe, experienced a very difficult birth. She had to be pulled out of the birthing canal because she was going to suffocate. And in doing so, the doctors saved her life. There's no question about it. She was purple when she was born. They had to resuscitate her and do all kinds of procedures to make sure that she was going to survive. So I don't blame the doctors for what they did, but in the process of pulling her out, they had to, and I saw the whole thing, they had to shimmy her out essentially by grabbing her cranium this way and then twisting her head to pull her out. I didn't know anything about anatomy. I didn't know anything about neurosomatic therapy at that time, but I knew something was obviously very, very wrong. After Zoe was born, instead of giving her to Mel, her mother, they whisked her off. They took off to another room. Something was really wrong. I had no idea what it was. They were resuscitating her. They were saving her life. In doing so, however, they distorted the position of her C1, C2, and they distorted her cranium. I didn't know all this at the time, but I did know that she was having delays. My wife and I were both educators, and we understood how children were supposed to develop. So there were delays in Zoe's speech, there were delays in Zoe's walking and hand strength, everything imaginable. So we had her going through multiple therapies to help her with that. At age 4, we decided to move to Florida when Zoe was age 4, and that was to try to help her as much as possible, to simplify our lives and make sure that she had the support that she needed. Well, that was incredibly fortuitous because there was this thing called neurosomatic therapy in Florida that wasn't anywhere else at the time.